Welcome. This training is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar on our website at nhadaca.org within our webinar library. After completing this training, please complete the quiz and evaluation if you're interested in receiving a certificate. You can find the quiz and evaluation on our website next to the Watch Now button you selected to view this webinar on our website. If you're a member of NHADACA or NADAC, the certificate for this webinar is free. If you are not, the fee is $15. You will receive a certificate worth 1 CE once you have completed and passed the quiz and paid for the webinar, if applicable. Through the New Hampshire Training Institute on Addictive Disorders, this one-hour event is pre-approved by the New Hampshire Board of Licensing for Alcohol and Drug Use Professionals, as well as NBCC. If you have any trouble viewing the webinar, audio problems, or any other technical questions, please contact us at 603-225-7060. Please email any questions regarding the material you see today to training@nhadaca.org. Thank you, and now the training.
So when I talked about putting together the stages and the processes of change, one attempt that we did, this is the Velasquez and Crouch and Stevens and myself, developed a group treatment approach based on the skills and strategies that could be mastered by clinicians, but clinicians who believe in the client's inherent ability to change and tailored to meet where they are. So we tried to design a client-centered, goal-directed style using explicit change processes. So how do we elicit these specific change processes to promote change? And we developed it so that we were using MI spirit and strategies to complement the trans-theoretical model to facilitate change. And the hope is that people would find it intuitive, comfortable, and effective. I have heard from some folks who use this that they found it very helpful and useful. So this is the book that we did. It's actually a manual for therapy, a stage of change therapy manual. And what we do in this is we actually teach people in the first session of every group that we kind of suggest, either the pre-contemplation, contemplation, or the preparation, action, maintenance groups. We teach them the stages of change. So it's and each group is based on a specific process of change. So these are the kind of things, and this is, you don't have to do this, but this is the kind of thing that we are talking about when you're trying to adapt a group to focus on the stages and the processes of change. So like I said, we teach the stages of change. Much of that, what we say, the change process objective is consciousness raising. So we want people to become more aware of where they are in this process of change. And so we teach that. So you'll see that there's a lot of consciousness raising and self-reevaluation and dramatic relief here, or emotional arousal, in these first 6 sessions that we have. And again, this is for the pre-contemplation, contemplation, preparation sessions. We do have a session. I mean, again, this is not rocket science. These are not things that you don't do. It's just that we're doing them consciously, focusing on trying to kind of engage these processes of change. So we look at the physiological effects of alcohol, and we try to get them to kind of think about and talk about those physiological effects, and hopefully getting some consciousness raising and maybe some self-reevaluation too. Again, remember these processes, you were trying to kind of identify them, but they also work in combination with one another. Expectations. What are the expectations that you have about alcohol or drugs, or about living this kind of a lifestyle? Again, trying to get them to do consciousness raising and self-reevaluation of what their expectations are, and is this lifestyle meeting the expectations you had for it? Again, we continue. So we have about 14 or so sessions for each set of groups. And we talk in the beginning of the manual about how do you do this? Do you do it? Do you have two groups that are running at the same time and graduate people? That's one way to do it. To do research, what we had to do one time was actually pick 4 pre-contemplation, contemplation, preparation sessions and 4 behavioral sessions to create an 8-session group. Well, that worked to some degree, but again, the people who were further ahead found it a little frustrating to have the first 4 sessions focused solely on pre-contemplation, contemplation. They were ready to plan and they were ready to take action, and so basically they were a little frustrated by that. So you can graduate people, you can have people sequence in, so you have a certain number of sessions for that are more pre-contemplation, contemplation, preparation, and then graduate people over, or keep people in that same group and rerun other sessions depending on what you want to do. I will say that many of the people who use this manual have probably created a 12-session group or something like that, and have some pre-contemplation, contemplation, preparation, as well as action and maintenance things in some sequence. And that's okay. It's just realize that not everybody might be on the same page, and allow people who are in earlier stages to kind of use the same information differently. So, it doesn't hurt to have, so here we have a session on the pros and cons. It's really focused on decisional balance. It's really focused on doing self-reevaluation and environmental reevaluation. Okay. And so basically that's what the decisional balance is about. But again, you could do this if you have people further along. You could have them redo or reaffirm their decision-making process and the reasons that they're doing this. So you're not, you're in some of the early stages, you're having them to find the reasons that would be pros for changing your behavior. In the later stage folks, what you're trying to do is get them to kind of firmly kind of go back and make sure that their decision is really strong. So again, in building the strength of the task, you can keep doing that. So again, we've done that. We actually have a session on confidence and temptation where we teach that, and it's self-efficacy. But again, you're thinking about experiential and behavioral experiential processes here, leading into the behavioral processes. Because we want people to understand their temptations and to build their confidence. This is critical in building a change plan. In this preparation, action, maintenance sequence, you have more focus again. If we were running this as a separate group, we would start again with the first session being stages of change. If it's a sequential group, we would have people move in and then pick some of these ones that you think would be most helpful to your clients. And again, there's, this is a focus on reinforcement management, counter conditioning and stimulus control, and reinforcement management, new ways to enjoy life. Managing cravings and urges is really also focused on those 3 behavioral processes. Managing stress is really about counter conditioning. Identifying triggers is really about stimulus control. So we're trying to target these processes for these individuals so that they can experience this group as a kind of help to kind of activate some of the processes. And again, you're not going to get everybody to activate every process all the time, but that's the goal of group treatment, it seems to me. And again, you don't have to use this. You can use any of the group stuff you're doing, so long as you're aware that what you're doing, where are some of these people? And how am I going to reach them, or how am I going to take the topic that we're talking about today and make it work for people who are in earlier stages and people who are in later stages? If I'm going to do a group that's integrative, like you were saying, we don't have a lot of resources. We have to do one group. Well, that's okay. You just have to make sure that you're trying to get people, address people where they are. I saw a video of one of our people in our research project running a group, and she was really very, very talented about having to do that. So she had somebody who was in pre-contemplation and just determined not to make a change. And so he was kind of arguing about, not to change any of that. And so she just very quietly kind of said, well, it sounds like you really are not ready to take any action, and that's okay. You are really not, you believe that's you're in pretty good shape right now. So I'm going to ask you that's fine. You do not have to say anything. You don't have to do anything right now. You can listen to the folks, but I wonder if other people have found that there are some compelling reasons for them to make a change or to think about change right at the present moment. And so she transitioned very nicely, leaving the person in pre-contemplation to allow them to be in pre-contemplation, but also making sure that she was trying to engage other people who may have been further ahead in contemplation or moving toward preparation. So that's the idea behind this. I think it's really important to realize that what we're trying to do, and you have a handout also that talks about using MI in groups. But it's really important that we understand that some factors that are not always as relevant in individual MI are really important in group MI. So altruism. So trying to see, members often see that support and help they provide result in benefits to other members. So we're trying to engage that altruism. We want people, even if, so what worked for you the last time when that happened, or what happened here? So we want them to see themselves as being able to support someone else, because that actually is something that's important for all of us to kind of have a sense of being able to help others. Universality, that's a group experience, that we're all in this together, that many of us, even though we haven't had the same experiences, have a kind of a perspective on this that's very similar because we've experienced it. And sometimes if you emphasize and increase the universality, it increases disclosure and bonding and mutual support. So it can be a very powerful force for change in groups. Vicarious learning. So vicarious learning means I don't have to do the thing to learn. I can model. It's really about modeling. And it's essential in group MI. So I can't get every person to talk all the time in group because that's impossible. So we have less time to evoke change talk from each individual client. So trying to kind of link the members and trying to link the process together, it can facilitate that. And so I may not be able to say it myself, but if this other person says something that really strikes me as relevant to me, that both hits the universality as well as the vicarious learning and the modeling. And so I can learn from that in group, whereas sometimes you can't do that in individual. Here's some guiding principles for working in groups. You want to maximize group members' participation. While it's okay and somebody can sit off in the corner and have a lot of vicarious learning, you do want that person to engage at some points along the way. So you want to try and maximize the participation, and you may have to reach out and ask somebody, or encourage or elicit that person's kind of participation. You want to encourage members to take ownership of the change. Each of these individual group members has to be the author of their own change. And that's, I think, important. You want to explore both positive and negative experiences, but not focus too much on the negative experiences. I'll talk a little more about that later. You want to facilitate group cohesion and collaboration. Tailor content to broadly address the client's interests and experiences. So you don't want to kind of narrow in so much on a topic that it's only going to be relevant. And that sometimes is a danger in group is you start talking with somebody who's very verbal, and that person kind of begins to dominate the group with whatever their theme is, as opposed to kind of backing back out again from that and making it more generic and trying to kind of engage some of the other people in the group. And clearly in MI, you want to focus on potential solutions. In the group, you do want them to acknowledge their problems, but not wallow in their problems. You want them to focus much more on the solutions than the problems, though they need to understand the problems to get the solution. So you try not to run ahead with the furthest member or hold the group with the member or hold the group back with the member in the earliest stage of change. So sometimes, you can get somebody in pre-contemplation that the provider or the therapist believes, okay, I've got it. My job is to get this person out of pre-contemplation. And so you spend almost all the session focused on this person, trying to evoke that stuff. And you end up doing the second thing here, which is having consecutive individual mini sessions. So that's not group therapy. That's individual therapy done in group. So you really want to be careful not to just focus on one individual, and you want to keep pulling back from the individual concerns and what topics you're working on the individual to broadening that to the group to make sure that you're engaging other people in the group. Otherwise, people will kind of tune out. And you want to connect the moments that individuals are talking about with those that other individuals in the group are experiencing. And again, you don't have to get everybody talking all the time. That's impossible. So you have to depend on vicarious learning, where you depend less on overt change talk than you do an individual. So we want individuals to be thinking about their own situations and make progress even when other people are doing the talking. So you as a leader, what are your jobs? And this is where you need to be creating and maintaining the group. You need to be building a group culture and developing productive social norms. Okay, so you want people to treat each other respectfully. You want the social norms in the group to be functional and supportive of one another. You want to be demonstrating concern for the group, the welfare of the group. So that's the piece that's a little different than individual. In individual therapy, we want to focus on the welfare of the individual, but we also want to focus on the welfare of the total group and to keep that group healthy. You want to be modeling the MI skills. So we'll go over those open-ended questions, affirmations, reflections, and summaries. But you want to model how to use these. You want to activate the here and now interactions. You want to promote members' interactions and eliciting clients' thoughts about what they learned from the group. So you want to kind of help them respect the group as well and do that. And you want to foster their own self-awareness. Here are some general principles also for using MI in groups. Optimism. Focus on positive growth, not just for you, but also for other members of the group. So try to reframe when negative experiences are brought up. And I'll talk a little bit about change talk and sustain talk, but this is where that comes in. Sometimes in group, you get a lot of people who want to talk about the negatives in their lives. And maybe they're working on kind of how bad it was so that they could build a decisional balance. But sometimes they get lost in focusing on all the negative experiences. And so you want to acknowledge it, but you also don't want to amplify all the negative reactions that somebody's having. And that's important because you can actually, groups can be kind of pathological or problematic in some ways if they kind of go off the rails. And if you get something focusing totally on negative reactions or all of those kind of things, a lot of times you get a spiral that people just start talking about how bad it was and how terrible it was, and they don't get the optimism or the focus on solutions. So we have to avoid that. You want to roll with resistance and frustrations. Allow the client to feel heard, but lead clients to more productive, future-oriented discussions. So acknowledge, but move forward, and that's critical. And this future-oriented, we kept saying this a couple times now. Sometimes clients want to focus on the past. Recovery is future-oriented. It should be future-oriented. And discuss any thoughts and emotions to promote engagement. Again, self-efficacy, we've talked about that. You're trying to support self-efficacy, empower clients to explore options, make decisions, initiate change. So you're always emphasizing client autonomy. It's your choice. The group can't make you do anything. I can't make you do anything. You need to make your choice about what you're going to do. And you do that often by affirming what people have chosen to do that's helpful in groups. Include group members in all possible decisions and responsibilities. So you do want to, depending on how much you give leeway to the group about which topic they're going to talk about next or what other kind of thing, you want to try and make sure that it's a group decision, not an individual driving everything. You avoid excessive advice giving and redirect the group when this occurs. In MI, advice giving is usually not what you want to do, and I'll talk a little more about that, and support people's confidence and change. So you do have members in different groups, so they have different needs and they have different perspectives. So how do I honor the perspectives of each of these individuals while trying to kind of make sure that most of them are getting as much as they can out of it? So why did we incorporate MI? Well, motivational interviewing is one of the few approaches that actually was pretty well designed for pre-contemplation and contemplation activity and tasks. It also can enhance the client's intrinsic motivation to develop, initiate, maintain behavior change. So it's good, even that style and the style and spirit that you're using, as well as the strategies that you use, can also be used in helping activate behavior change processes. Some of the assumptions of MI are really critical. Motivation is a state of readiness. It can fluctuate and be influenced over time. So it isn't something where you kind of, I've got it. It's something that's ongoing and can fluctuate. Your way of kind of reacting and empathy is really a powerful factor in bringing out self-motivational responses and in reducing resistance. And we've seen that in individual, you can see that in group. There are fluctuating and conflicting motivations. Ambivalence is really a normal part of change. It's normal to be ambivalent when confronted with the possibility that I need to change a behavior. Okay, so that's normal. The last piece I think that's really important is we have to believe that each client has a powerful potential for change. Clinicians are not very good at predicting who will change and who won't change. As a matter of fact, they're pretty bad. And a lot of times you have these people, say, oh, well, no, that's really, oh, look at that severity on that person's never going to change. And that's the person who changes. Some of the people with least severity are the people who don't change. Sometimes when you do an intake and somebody believes in the clinic and they go, okay, well, this person's not going to change. Who should we assign them to? Oh, give them to the student. The student doesn't know any better, then they can't do any harm to this patient. So let's just give them to the student. They can practice on this patient. Well, sometimes the students don't realize that this patient can't change, and they actually work with them and the person changes. So we're not very good at that. And so we need to believe in the potential of the individual to make the change happen. Okay, so I'm going to show you this video. This is an example of kind of what not to do. Back here, start it back here.
Well, welcome. I really am glad to see you today about the group. We're doing our second smoking cessation session, so I wanted to kind of start today by talking about change. So think about a change that you were able to make in the past. Okay, so take a moment and think about it. Now, didn't that change make you feel better about yourself?
Yeah, it did.
Okay, good. Anyone else feel better?
Well, sure. I mean, it always makes you feel better when you set your mind to something and then follow through with it.
Mm-hmm.
Yeah, me too.
Good. So wouldn't quitting smoking make you feel better?
Definitely.
So Kate, we haven't really heard from you yet today, and you look a little askance, possibly. So wouldn't quitting smoking make you feel better?
Well, yes, probably in the long run it'll make me feel better. But for me personally, I'm just worried about quitting smoking now. I'm really afraid that I'm going to get stressed out and depressed, and then I'm going to overeat, and then I'm going to gain weight. And, I'm worried about using again as well. So I'm just not sure if I'm ready for that right now.
Yeah. So you're really worried that quitting now is going to really keep you stressed. It may even lead to weight gain and even to relapse, possibly.
Yeah.
Does anyone else have worries about these things?
I really worry about weight gain and stress a lot.
Okay. Does anyone have any suggestions about how to deal with these issues?
With a weight gain, you could just eat less.
No,
Easier said
I
than
mean,
done.
seriously, if you're worried about weight gain, if you're worried about exercise, you should just excuse me, if you're worried about stress, you should try exercising. I mean, exercising will definitely reduce the weight gain. It will probably help out on the stress. So, yeah.
Yeah, that's good, John. I mean, research really tells us that, exercise really helps you with the endorphins in your brain. It really helps you in terms of losing weight and keeping weight off. So both of those are really good things. And eating a diet low in fat and calories can really help weight control too. So I wonder, Kate and Sarah, whether you two might be willing to give that a try.
I'll be able to try.
I guess so. I could start walking or something. I'm not sure about the diet thing.
Mm-hmm. Okay. So good. So you have now kind of some ideas about that it's going to really be helpful to quit smoking, and you kind of have some tools or plans that maybe you could do some of these things. So what I want to do now is move on and talk about the change plan and how each of you could kind of use those tools to quit smoking.
Okay.
So that wasn't really a good example of using motivational communication in group. You saw it pointed out, closed-ended questions, not respecting autonomy, and doing some of that. So let's go over some of the motivational communication things that are important. And the spirit of motivational communication is really critical. Actually, Bill thinks that, and Steve think that sometimes that this spirit of motivational communication is more important even than the strategies. So we're talking about partnership, that it's a collaborative kind of thing. Evocation, that we're trying to draw out from the individual. I'm not trying to tell people what to do, which is what I did in that segment of that tape. Trying to get people to accept. So making sure that we're accepting of these people, and acceptance that yes, we may not appreciate or like that they're in pre-contemplation, but I'm going to accept you in pre-contemplation because that's where you are. And compassion, that we're really involved and engaged in doing this because it's important for you and for your health. So it's not so I could have more numbers in my group. But that's the spirit, and it's multidimensional and important to kind of keep all of those things in place. So then there are the skills. So the skills are the oars, and most of you have heard of this, I'm sure, before. You use open-ended questions, you use affirmations, you use reflective listening, so you really reflect back to what you've heard from the clients, and then you summarize. So these skills can really help you engage the client and lead the client to make more self-motivational statements. And again, you know what open-ended questions are. Anything that can't be answered, well, you know what a closed-ended question is, or some of the questions I used in that last piece, which was, okay, well, wouldn't you feel better if you made a change? Yes. Okay, well, that doesn't get me anywhere. So you really want to ask the open-ended questions to explore what that person, the perspective of the people in the group, the perspective of the individuals. And you want to spread that open-ended question to other people in the group as well. So once one person has responded, you can kind of not just say, oh, doesn't everybody else feel that way? Yes, and then they're done. No. How about, are there other experiences that are similar to that some others of you have experienced, that you'd like to share, or something like that? Affirmations, making sure that you really affirm some of the positive things that some of the people are saying in the group about what they've been doing. It's really important that you give genuine feedback affirmations to individuals. Reflections are really important. How do you reflect in a group? How do you kind of take your reflection on this individual and then move it to expand it to the group? So this individual is saying something, you reflect back what they're saying, but you also then spread it around. And then summaries. You use a summary to kind of either to make a transition in the group to another piece of the topic, or you make a summary to kind of close off a discussion piece that you're having with a particular client so that you move on to work with some other client in that group. So you use summaries strategically to kind of shape how you move in and out of topics across a group.
Well, thank you very much for coming today to the group. We're going to kind of work today, forward our work on smoking cessation. And what I wanted you to think about is think about a change that you were able to make in the past. What were some of the benefits that you experienced from making that change?
Well, since I've quit drinking, I've lost 20 pounds, which I'm really proud of. And I also noticed that I don't argue with my family as much anymore about the stupid things that I used to do when I was drunk. So that's a plus.
That's great. No, so you've lost some weight, which you're really happy about, and you're getting along better with your family since you quit drinking. So what about some others? What are some of the other kind of things, benefits?
Well, I just quit using, and it hasn't been easy, but I'm actually sticking with it this time, and I think that's definitely a benefit.
Congrats, that's great. I mean, as for me, and believe it or not, I've actually quit smoking before. That was years ago. But I saw some benefits in that.
So what kind of benefits, John? Can you tell us a little more about that?
Well, it made breathing easier. I've got an active job, and so it made working easier. Just walking. It made going upstairs, up hills. It made playing with my kids easier. My wife worries about me, about my health, and so that's nice when I'd quit. And she says that when I'm smoking, that kissing me is kind of like licking an ashtray. So
great. Well, thanks, John. I appreciate you sharing all of that. So most of you, if not all of you, have experienced some changes in the past that have helped you and kind of you feel good about. And you've experienced some benefits in terms of some of the physical health, family, spouse kinds of stuff, in terms of fighting with them, confidence in your ability to kind of overcome addictions. So we've heard from John some of the benefits that he experienced the last time he quit smoking. I wonder if some of you could talk a little bit about the benefits, what other potential benefits might come from quitting smoking. What do you think?
Oh yeah, saving money is also a benefit. I mean, cigarettes are a lot more expensive than they used to be.
I'll agree with that one.
Yeah.
One of the things that I'm hoping, when I smoke, I want to drink. Since I've quit drinking, I don't want that to interfere. So hopefully when I quit, I won't have the trigger to reach for alcohol.
That's a good point. That's a good point. So it's important for you to staying off alcohol, and quitting smoking will really help you do that.
Exactly.
That's great. That's great. What are you think others of you think of benefits about quitting smoking?
Well, I mean, if smoking is a trigger for drinking, and you definitely want to quit drinking, then definitely quitting smoking is a benefit. I mean, I actually, until you said that, I mean that's the same as me, and I hadn't realized it, but that's definitely a benefit as well.
So in addition to some health benefits, the breathing easier, the quitting smoking and supporting abstinence from drinking, what else? Are there other things? Andrea, Kate, Alex, anybody kind of think of other things that would be helpful?
Yeah, well, it's a no-brainer that if you quit smoking, you're going to lower your chances of getting cancer in the future. So that's definitely a benefit. It's just that for me personally, right now, I'm just afraid that if I quit, I'm going to get so stressed out and depressed. I'll probably start overeating and gain weight, and I might even start using again. And I just don't know if I can handle that right now, and I really don't need another depression episode.
Right, right. No, I agree with you. And so it sounds like it's really, on the one hand, you're kind of really worried about the stress and the depression and the possibility it can trigger some relapse or other kinds of negative things, weight gain, other things for you.
Right.
But on the other hand, it sounds like you have still some reasons or some things that might be helpful if you could quit smoking.
Well, yeah, I'm just worried about the stress and the depression and the weight gain. But listen, I know I need to quit smoking. My doctor's after me all the time because I have a family history. My mom's in the hospital right now with stage 4 lung cancer.
I'm so sorry.
Thanks.
Kate, I am so sorry to hear that. Well, you have to quit smoking if you have a family history. And try exercising. I understand that that's going to help reduce the stress and the weight gain. That's what I plan on doing when I quit smoking.
Sarah, I think that was really helpful in terms of your concern for Kate and for her not getting in the place where her mother is now with cancer. But I wonder, sometimes if we tell people what to do, they don't really respond very well. So I wonder if you could kind of reframe that and rephrase what you said and ask her permission if you could make some suggestions. That might go over a little bit better.
I don't mean to tell anyone what they should or should not do. So, Kate, may I make a suggestion?
Go for it.
Well, someone told me that exercising does help reduce stress and help with the weight gain.
Great. Thank you, Sarah. That's helpful, and maybe that will help her to kind of think about that a little more. So, Kate, what do you make of that suggestion?
Well, I'm willing to give it a try. You know, if exercise will prevent the weight gain and, you know, help with the stress and depression, and I know I need to quit, so I'm willing to give it a try.
So obviously exercising then becomes one of the tools that you have in your toolbox. So what are other tools that could help you support quitting?
Well, my meds, you know, they make me cloudy and they just make it hard to focus. And when I've quit smoking before, I really struggle with being able to focus because, you know, quite honestly, smoking helps you focus. So a tool, I don't know if it's a good tool, but a tool I've used in the past is caffeine, you know, coffee, just to help me focus and get through.
Yeah. So having some caffeine would be one tool that you could have to help you in the difficulties with kind of focusing. What other tools might be helpful in support quitting?
I think gum or some sort of candy would be a good replacement.
Yeah. And one tool I've been thinking a lot more about lately is using Chantix, that one medication that's supposed to help you quit smoking. I'm not sure about using it, but I'm thinking about it.
That's great.
Yeah.
No, I think about medication can be helpful, and people should kind of consider those. That's great. So that's excellent. All of you have kind of thought about some of the benefits and the potential benefits for quitting smoking for each of you, and I think it's really important that it's your own personal benefits. And then you've thought about some of the tools that are around that you can think about using when you kind of come across some of the barriers or the challenges that you meet when you're trying to quit smoking. So that's great. What I'd like to do now is see if we can kind of move to looking at how we can incorporate those tools into a change plan that each of you could make for yourselves. So we could go on and look at the change plan worksheet that we have on page 12 in your workbooks.
So that was the better example of doing group. I wanted to kind of go into also some of the change and sustain talk. You know, in MI, they talk a lot about this change and sustain. So ambivalence is a normal part of change. So it's often you hear both the change and sustain talk that's intertwined, right? So, you know, you heard Andrea, I guess, in that last video kind of going, well, it's a no-brainer that the change happens, but, and as soon as you hear but, you know that the other side is coming in. I'm going to gain weight. I got stress. I got this. I got that. And so there's sustained talk and change talk in the same kind of conversation. And when you're talking about that, you know, I mean, think about self-motivational statements. A lot of those are involving self-reevaluation, environmental reevaluation. You also heard Andrea say, you know, look, I know I've got to quit. That's a beginning of a reevaluation of who she is and how she's connected to tobacco. So I'm bringing the change and sustain talk back together with the processes of change, because I think that's what you're trying to do all the time. Now, some of those self-reevaluation can also be used in sustain talk, right? You can say, yeah, but it's going to be too hard and this and this. And that's a self-reevaluation that says, I'm not going to change. So you get to see both of these in group, and you see the going back and forth at various times. And now there are certain types of change talk that we sometimes hear. So desire, you know, is Bill especially, I think, loves these acronyms. So we have DARN language. So desires, abilities, reasons, and needs. So you're always listening to kind of hear that. I can do it. I'm able to do it. I could do it. That's in individual, you want to kind of highlight that. In group, you also want to highlight that. So you want to look for the change talk and try to find out where that is, and then highlight it in your reflection, and then spread it out to the rest of the group. So that's what you're trying to do across all that. You know, I mean, Andrea was clearly, I need to do this. Who was it? The other woman had specific benefits. You know, I don't argue so much with my family. That's good. And in the money and other kinds of things, they're all reasons. And so you're looking for this change talk to kind of highlight it and deepen it so that it helps them move to the decision piece. So this is usually seen more in pre-contemplation and contemplation. As you kind of move out of contemplation and into you start hearing some other things that people are saying. I'm going to do this. I will do this. I promise to do this. There's commitment language. And again, those of you who know MI, there's been some research, the greater or the stronger the commitment language, the greater the probability the person's going to try and make a change. But you can also hear in some people's, you know, I'm ready to go, I'm starting, I'm prepared to, I've got, one of the women was thinking about getting Chantix. Okay, well, that's a plan, beginning a plan. So how do you do that? That, you know, I might have, had I had more time and not trying to do just the generic group, I might have focused on that a little more and say, well, how would you get it? Where would you get it? All of that kind of stuff. And, you know, so maybe, you know, it really would be important to talk to your doctor to kind of see if you can get that and how it could be helpful to you. So she may be a little more ready. She said she's thinking about Chantix, but, you know, I would probe and try and figure out, and then see if anybody else had thought about any other kind of aids, nicotine replacement or other kinds of things. And then taking steps. I mean, if she didn't say that, if she said, oh, yeah, I'm planning to talk to my doctor about Chantix. and then I would have a different reflection, and it'd be much more about preparation or action. And then kind of again, when you're talking about group, you're talking about, I want to focus on her and seeing what she's going to do, you know, and try and get her to kind of say, well, when are you going to do that? Is that in the plan? And you say, yeah. She says, yes, I'm going to do that. Has anyone else thought about it or planned to kind of use any other kind of support systems or medications? So you're always trying to spread out the individual's kind of realizations and change talk, and compound it by kind of spreading it out to the group. And so here's just some examples of what clients have said. So this client says, I'm in preparation. I mean, I want to stop. I hope like hell come Thursday night that I can make it home in time to come to this group, because I think that will help a lot. Because if I can get here and okay, I can go to group, because I mean, I don't want to use. I don't. That's the last thing I want to do. So that's the reflection of the therapist really trying to help this person. So having some kind of a plan might be helpful. And then that would continue a conversation and do that. And maybe this person is in preparation, but we're not sure. They're at least in preparation for coming to group. Whether they're in preparation for stopping, we're not sure. I sense still some ambivalence here, but you know, that possible. So here's a client. Can you be in two at one time? So the therapist can go, well, I don't know. Tell me about it. Well, I mean, contemplation and preparation. Okay, I mean, thinking about quitting, wondering how it will affect others, maybe trying small changes. Okay, I'm kind of in that stage a little bit. Well, not a little bit. I'm in that stage where, okay, let's not drink a 12-pack today. Let's see if you can drink socially. So that's a big jump. But so yes, this person is in contemplation. Probably they're thinking, but they may be in preparation for cutting back. But in contemplation for stopping completely, or in pre-contemplation for stopping completely. So again, if you're listening, so how do people talk? How can I tell people what stage they're in? Listen to them, let them talk. They'll tell you what they're thinking about, what's happening and where they are and what they've been doing. So if you get to their thoughts and feelings and behaviors, you can figure out where this person is in the stage of change and where they need to be going. So this is what I was talking about before. How do we balance? This is a common dilemma in group, that you have group members engaging in change talk and decision making, and group members using sustained talk and arguing against change. So what do we do? So how do we diffuse resistance in group? So when negative comments and sustained talk arise, we can reframe them into friendlier, more cooperative style, affirming the person who's making the objection, but perhaps adding a twist to the comment. So this is kind of, if you know motivational interviewing, it's agreement with a twist. So you agree to kind of support the objector, but you also twist it to comment and try to reflect any hints of change talk. So somebody says, you know, gee, I can't, I mean, I just can't stop using cocaine. It's just, it's part of who I am and what I do. And I don't know what I would do without the cocaine. And so I'm gonna kind of, so, you know, so cocaine seems to be very important in your life. And certainly has taken center stage, even though you might be kind of a little worried that it might have overtaken your life. So now I've done a twist. Now, he didn't say it overtook his life, but he expressed that it was almost like that. So I'm now giving the affirmation of, talking about that and then adding just a little twist to that so I can add in a little bit of change talk that maybe it's overtaking your life. Sometimes you can ask quieter members or those who are more experienced for their reactions to permit an alternate viewpoint. So, if you know somebody's a little further ahead and has thought through this and thinks maybe this isn't a great idea to stay on using cocaine, then, you might want to kind of turn, when this person says this, you might turn to another member and say, well, so what do you think about that? How does that strike you? What kind of reaction do you have to that kind of a statement? And they might say, well, I agree, it does take over your life. I mean, that's been what I've been struggling with the whole time, is how to really put the cocaine away and move it back into the background so that I can live my life more fully. So that's part of what you're trying to get. In diffusing resistance, you can also emphasize the most relevant comment using a group summary reflection. So I have 2 or 3 people talking about some things and one who's kind of giving more of the negative, I can say, okay, so a number of you have kind of talked about this. There's this, and somebody's not so sure, but other people have a little more meaning and have some things that they're trying to do to make this change happen. So I kind of acknowledge, but emphasize the more action-oriented or the more decision-making oriented kind of comments in the. Again, any questions or comments about some of these examples or the diffusing resistance in group?
David says, does it happen more that the sustained clients put change clients to their side, or does the reverse happen? What is your experience?
I don't know. I think it could go either way. I do think, depending on, and this is part of where, in terms of the balance in the group, I mean, if you have everybody in pre-contemplation, a lot of times that's what will drive the conversation more to the sustained talk side. If you've sprinkled it with more people who are in contemplation or preparation or whatever, then you have a chance to kind of help people kind of move some of those folks to influence that group and to see if you could kind of balance it out. So I think sometimes it depends on the composition of the group, and sometimes it depends on the skill of the leader in terms of how can I kind of reframe some of this? How creative can I be in kind of pulling some change talk out of some of this resistance, or going back and finding out, has any of you experienced kind of some time when you were off? And let's change the conversation to some of your success experiences when you actually were successfully off. And what was that like for you? And some of them may be more negative, but some of them may have some positive in there to try and find. So I don't know if there's a rule of thumb that says, one will experience the other. Sometimes it also depends on the individual who's talking. So, in group, you get certain people who want to be co-therapists with you, who really want to take over the group, and who's kind of try and almost kind of run the group themselves. So depending on who that person is and how much sway they have in the group, they may influence kind of which way the group goes. So I think there's a number of factors that come to play in this. And again, with your group co-therapist, I really try to kind of help them with the rules of, well, hold on a second, I really would like you to kind of, I know you've got a lot of good things to say. This is really important, and for you in terms of your work, I will ask you to kind of let some other folks talk as well, because I think it's really important that for the group and for the health of the group that everyone gets involved to some degree or another. So I try to get the group co-leader to kind of calm down and engage more other people and tell people that we in group we share talk time. I don't have to be talking all the time. I want you to be talking, but you need to share among yourselves talk time. And remember, in MI, talk time is critical. Some of the research shows that the more the client talks, the better the outcomes. And actually, they were giving estimates. So you listen to a therapy session. A good balance in MI would be the client talks 70% and the therapist 30%. So that's again what I think you were reflecting on when you were reflecting on the two different groups, was that in the first group, I was talking more, trying to run the group, trying to push the group, trying to do all of that stuff, and shutting down conversation, as opposed to the second one, where I was really kind of trying to engage more of the group and having the group kind of do more of the things that they needed to do. I don't know if that answers your questions, David, but if you've got other thoughts, just feel free to unmute and share. Melissa, any other thoughts or questions in chat?
Nothing else.
Okay. The other thing to do is use what we call decisional balance exercise. That also sometimes can diffuse resistance, where you ask group members to brainstorm a list of reasons for not making change. So you're really asking about all the good things about their drug use. Then you invite the group to make counter arguments, why change would be a good thing. And so you have, what you want is, we know this from actual research in communication and stuff. If you get people arguing for a point, they kind of feel more connected to that. So you really want to get the group to make the counter arguments. Why change would be a good thing? What would be the things that you do? So you're trying to kind of get them to do it out loud, decisional balance. And then your job is to summarize the main points of the arguments for change, and then maybe ask some members to elaborate on their own reasons for change. So this reinforces the change talk in the group's words and promotes decision making, while also diffusing the people who kind of have, okay, if a bunch of people want to talk about all the list of reasons for not making a change, let's make a list of those, and then now let's argue against those. So it's another strategy that you could use. Summaries are also very important. So you want to strategically use summaries to review and highlight the relevant information provided by the group. You want to use summaries to reinforce the change talk. You want to use summaries to relate a response by one member to an earlier comment from another member. And then you want to use summaries to transition the group discussion to another area of focus. So summaries are really very wonderful tools, both in individual and in group therapy, of ways of managing the conversation without kind of going, okay, that's enough on that, let's move to this topic. A summary is a gentle way to kind of do that, as opposed to kind of brute force moving from topic to topic. And that's true in individual as well. I mean, I train doctors to do SBIRT. And what we've always trained the doctors to do, the doctors go, I can't ask open-ended questions. I said, why? They're going to talk, and then I'm going to have to shut them up. I go, no, you can use the summary to do that. Say, okay, we've now talked about that. Doesn't sound like you really want to quit smoking, or you don't want to change your diet right now. You might be thinking about doing some exercise, but you're still working on that and thinking about that. So okay, so that, does that kind of capture where we are? Yeah, I guess. I mean, okay. So now I'd like to talk about your liver, or about your heart, or about whatever else I need to talk to you about. So you can use these summaries even with after a very short period of time to kind of summarize and move on. And that's a real skill to develop in terms of groups. The other thing that I think is really important in both individual and group is you have unique knowledge. You have expertise. So how do you share your information that you have, about recovery, about certain medications, about taking medication, about the problem of cocaine or whatever else you're talking about. So you have important information to share. The client has important information to share. So to increase the changes of the chances of, that should be chances, not changes, the chances of being heard and listened to by the client when you're giving information, I am teaching, and MI kind of uses, I think this came from Steve Rolnick and his work, the elicit, provide, elicit approach. So when you're trying to give information, elicit, ask permission and clarify information gaps. So first of all, find out what the person knows. So what do you know about, so I'm going to do the Chantix, she was asking about this. So what do you know about Chantix and disinformation, about Chantix and how it works for quitting smoking? Okay. And then the person tells you what they know, and you say, well, do you mind if I fill you in on a couple of things that I know about that, or share that other people have, share some other information that I've learned from other folks who've used Chantix? And you're asking permission because you want them to kind of say yes. Now, you have to be prepared. If they say, no, I really don't want to know anymore, you have to kind of move on, lick your wounds and move on. But basically, what most of the time people will say, well, yeah, go ahead, or as Andrew said, well, go for it. But basically, they'll give you permission. Now, once somebody gives you permission, they actually are more open to hear what you're saying. So that's the whole point of getting this. And you're also not going to give them information that's redundant. So the last thing, you need is somebody going back over information that you already know, because that actually just loses the client. So what you're trying to do in this elicit part is make sure you're not just kind of giving information that the person already knows. So clarify what they know and what they don't know, ask permission to kind of give more information, and then provide clear, important information. Give them some important information and then support autonomy. Say, the choice is really up to yours whether to use this or not. Don't prescribe that they have to do this. And then after you finish that, elicit their reaction. So what do you take from that, or how do you see this now? Get their interpretation, get their understanding, get their response. So what do you think? Where would you go from here? What would you do? What are you thinking about doing? So this is a way to engage the clients and get your information out there and share the information in a way that is probably going to be more informative and helpful to the clients than just kind of saying, I'm thinking about getting Chantix. Okay, well, Chantix is really great. Let me tell you some of the things about Chantix. I'm going to tell you, Chantix was done this way. There's been studies showed that this is done. And so I'm off on a soliloquy. But that's not going to help the client. I want to be engaging the client in the information. Okay, there's a couple of things that trying to kind of focus on that we're going to finish up with. So trying to focus on collaboration and creating an atmosphere of partnership means avoiding what they call the expert trap. You don't want to be the expert in the room. You may have expertise, but you don't want to be the expert, because then everyone else is a non-expert. And you have to make this collaborative. So you introduce your discussions with your collaborative language. Your experiences are going to be very useful in helping us to explore some of the ways drug use can affect others in our lives. Is it okay if we talk about that today? So I want to get them to be the experts. When I teach my students, there are I tell them there's two experts in the room. You're an expert on some of the therapy techniques and some of the stuff that you know. They're an expert on their lives. And your expertise has got to fit into their expertise or it doesn't work. And you have to acknowledge and honor their expertise as well as your own. Okay. There are common traps that they talk about. The information trap, which is providing too much information. The expert trap we just talked about. The premature focus trap, which you saw in the first version of the video, where I kind of moved everybody on to change where they weren't ready. They were mostly kind of ambivalent. The chatting trap, where we have people talk about their week, but it's not really about therapy. It's just about chatting. And then the fix it trap, which is you have a problem, I have a solution. And getting out of that to where as soon as somebody says that, I mean, it's really hard. I mean, even after I'm training these graduate students in motivational communication, I go, as soon as the person goes, well, I've got, I think I weigh too much. They go, well, have you thought about doing this and this and this and this and this? And that's what a lot of times what you get from friends in conversation with friends is the fix it. You don't hardly get the problem out and they're already fixing it. So how do you keep the spirit flowing? These are the elements of the spirit of motivational communication. And here's what it looks like if it's working and supporting motivation. Here are some warning signs. Provider motivation is greater than the client's. The thinking the provider knows best. Provider asks too many closed-ended questions. You're not going to get evocation there. You reply with one-word answers. The client replies with one-word answers. If they're going to be one-word answers, I'm asking closed-ended questions. Provider focuses on his or her own goals. Limited use of affirmations. Provider is frustrated with the client, so your compassion kind of wanes. And then here's really, if you're ignoring the client, if you're focusing on advice and not the client, if you're limited focus only on change talk, limited focus on their ambivalence, so you're not really focusing on the change talk and the ambivalence, no validation of autonomy, minimize the client's unique strengths. A lot of times people in group feel like they've been mandated. I know there are people who are mandated to treatment, but I tell you can't be mandated to change. So we need to kind of do that. And in fact, many of the clients I had felt that they were coerced into coming by family or spouse or other people threatening them that, I'm going to leave if you don't do this, blah, 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 blah. So there's a lot of coercion in our groups or in our treatment that's not necessarily coercion by courts, but coercion by context. And then limited prioritization, less empathy. So this is a way to kind of look at your group and see what kind of responses am I getting, and are things going well? Am I getting this spirit of motivational communication flowing? Okay, so at this point, I'll just kind of finish with a kind of group treatment in the process of change. So keep focused on group members' process of change. Make sure to address both the differences and similarities among group members. Use motivationally enhancing communication. Help the members of the group to self-assess and assist others in using motivationally consistent practices. So what I hope you saw in that second one was I really tried to redirect that person who was giving free and unsolicited advice so that it doesn't interfere with people just now, okay, I can tell other group members what they should be doing. Keep focused on individual progress and group cohesion. And changing addiction is really filled with, as you know, progression, regression, recycling, and then successful recovery. So we need to have patience to do that and especially do that in group.